Atrial fibrillation, the potentially life-threatening irregular beating of the heart, is a widespread condition with more than 3 million new cases developing each year.
Atrial fibrillation is one of the most common heart rhythm disorders that we see in medicine, affecting millions of people. It involves fast, chaotic beating of the top chambers of the heart and can lead to a lot of symptoms, including things like palpitations, fatigue, and shortness of breath, and also can actually lead to stroke, really disabling the patient.
When there's an aberrant electrical conduction in the atrium, and the atrium, instead of contracting, start quivering, not giving good flow of blood to the ventricle, that's what's called atrial fibrillation.
AFib can exist in what we call paroxysmal form, which is where the patient can go in and out of atrial fibrillation. Then there's what we call persistent atrial fibrillation, where you are in atrial fibrillation all the time.
For persistent AFib, your doctor may recommend the hybrid convergent procedure, a multidisciplinary approach that combines the efforts of both the cardiothoracic surgeon and the cardiac electrophysiologist in one procedure.
A hybrid AFib convergent procedure really combines the best of both worlds.
A cardiothoracic surgeon performs the first part of the hybrid convergent procedure. Then, while the patient is still under anesthesia, the cardiac electrophysiologist steps in to complete the treatment. Here's how the hybrid convergent procedure works. First, the surgeon creates a small incision in the abdomen, which allows access to the outside of the heart.
As a cardiothoracic surgeon, I use minimal invasive techniques to reach inside the pericardium, which is the sac around the heart, to access the back part of the heart, do the ablation or burning of set of lesions in the back part of the heart, which is the epicardial part of the procedure.
Using a scope and high-definition camera, the surgeon sees the heart directly. With a radiofrequency ablation device, the surgeon creates long linear lesions on the back of the heart that will interrupt the abnormal arrhythmia circuits in a process known as ablation. Multiple overlapping lesions are created across the heart's external surface. Once the cardiothoracic surgeon completes the epicardial part of the procedure, the cardiac electrophysiologist performs the endocardial ablation on the inside of the heart.
The cardiac electrophysiologist will perform a catheter ablation in a traditional way from the groin, where he passes long tubes up inside the heart and will take care of the remaining portions that the surgeon cannot access from the outside of the heart.
Much as the surgeon did on the outside of the heart, the electrophysiologist creates lesions around the pulmonary veins inside the heart to interrupt abnormal electrical currents.
With the catheters, we do testing to check for arrhythmias and to ensure that the ablation done from the surgical standpoint is effective and is going to hold.
The electrophysiologist does a mapping of the left atrium that can tell him how much of ablation I did during the surgery. With that mapping, he can use endovascular catheters to close the gaps that I had left intact, to close those doors for the electrical impulses.
The purpose of an AFib ablation is to reduce or completely eliminate atrial fibrillation. A number of studies have shown that AFib ablation is a much more successful way to do that than purely with medications or pacemakers or any other type of treatment.
The way atrial fibrillation works or it develops is by having abnormal tissue in your atrium. Once you have abnormal tissue for whatever other reason, abnormal impulses start developing that are self-perpetrating and will not stop. Sometimes you need to have these burning lesions to stop those conductions from perpetrating.
So who's the best candidate for this procedure?
A good candidate for the hybrid convergent procedure would be someone who has atrial fibrillation that's what's called persistent, meaning that it's not going away on its own.
Those who have either what we call persistent atrial fibrillation or long-standing persistent or permanent atrial fibrillation and have not had a prior open heart surgery like a bypass or a valve replacement. Patients who've had prior abdominal surgeries also need to be evaluated properly, although they can still have the convergent if properly identified by the physician.
For patients with long-standing or persistent atrial fibrillation, the hybrid convergent procedure combines the skills of both the cardiothoracic surgeon and the cardiac electrophysiologist to repair irregular electrical signals both inside and outside the heart.
Together, we can treat the most aggressive forms of atrial fibrillation, persistent atrial fibrillation, and long-standing persistent or permanent atrial fibrillation.